Are you tired of relying on painkillers to get rid of your headaches? What if you could cure them for good and transform your life? Welcome to today's video, where we're going to talk about a topic that affects millions of people worldwide: headaches. Whether you suffer from occasional tension headaches, migraines, or chronic pain, you know how debilitating they can be. Headaches can make it hard to focus, work, or enjoy life, and traditional solutions, such as medication or rest, often need to be revised. But what if there was a way to cure your headaches without relying on drugs or downtime? That's where neuroscience comes in. In this video, we're going to hear from a neuroscientist who has dedicated his life to studying the underlying causes of headaches and how to treat them in a science-based, effective way. Get ready to discover the secrets to a life-changing headache cure and a pain-free future. In a recent episode of his podcast, The Huberman Lab, Dr. Huberman discusses the complex issue of headaches in great detail. He sheds light on the different types of headaches, their causes, and various treatment options, including behavioral and prescription treatments. With his extensive knowledge in the field of neuroscience, Dr. Huberman provides science-based strategies to manage and alleviate headaches, making this podcast episode a must-listen for anyone who suffers from this common but often debilitating ailment. Do you guys know what headache origins are? According to Dr. Huberman, headaches can arise from various tissues in the head and neck, including the muscles of the skull, the meninges, blood vessels or arteries, and nerves. Identifying the tissue involved in a specific headache is important to get relief. Tension headaches, for example, are felt around the top part of the head, caused by constriction from the skull muscles. In contrast, cluster headaches are felt behind one eye and originate from nerves deep within the head. Interestingly, the brain itself does not have pain receptors. Instead, headaches are caused by the presence of nociceptors, pain receptors, in the surrounding tissues. Any change in the size of the vascular portals between the brain and these tissues can cause headaches. Dr. Huberman also notes that inflammation can cause headaches. When tissues around the head and neck release molecules called cytokines, they signal to the body that something is going on, which can lead to localized or systemic pain. To understand how to target headache pain, Dr. Huberman explains that it's important to understand the different types of neurons in the body. There are motor neurons that control muscle contraction, sensory neurons that respond to events in the environment or body, and modulatory neurons that adjust the relationship between motor and sensory neurons to determine our response. Medication and behavioral approaches can be used to adjust this relationship between neurons and provide relief from headache pain. Dr. Huberman's insights shed light on the complex nature of headaches and the various factors that can contribute to their onset. By understanding the specific causes and types of headaches, we can better tailor our treatments and find relief from this common ailment. What are the major types of headaches? 1. Tension headaches. Tension headaches are characterized by a headband or halo of the eyes and can involve the jaw and neck muscles and even extend to the upper back. They are typically induced by psychological stress and lack of sleep. 2. Migraine headaches. Migraine headaches are recurring and affect females 3 times more often than males, with no relationship to menstruation. They can be extremely debilitating, and aura is a prominent feature, with the experience of something about to happen either visually or auditorily. Photophobia, or sensitivity to light, originates from neurons in the eye that connect to the eye and respond to short wavelength light and blue light. Other symptoms of migraine headaches include dilation of blood vessels. 3. Cluster headaches. Cluster headaches feel like they originate from deep within the head and are usually felt on one side of the head. Symptoms include unilateral, deep, excruciating pain that can last long. They can occur suddenly during sleep and may be accompanied by a droopy eyelid, miosis, and nasal discharge. Men are more likely to get cluster headaches than women. 4. Hormonal headaches. Hormonal headaches in women occur due to changes in gene expression. They are most likely to happen when estrogen and progesterone are at their lowest levels, typically in the first week of the menstrual cycle. Progesterone and estrogen have an impact on the vasodilation system. 5. Headaches from injuries. Headaches from hits to the head and traumatic brain injury, TBI, result from swelling of the brain region, constricting the fluid flow. Most effects of a hit to the head don't appear immediately but may show up days, weeks, months, or years later. Over 90% of TBIs result from a bicycle, playground, car accidents, and construction accidents rather than sports. Raising the health baseline can reduce the risk of headaches and aid in TBI recovery. Adequate sleep, exposure to sunlight at the right time of day, avoiding bright light at night, proper nutrition, regular exercise, and healthy social connections are all beneficial. Taking aspirin is not recommended for any of the above types of headaches since it is an anti-inflammatory and may cause more blood to flow and further exacerbate pain. Caffeine may be helpful or harmful in headache treatment, depending on the type of headache. It is crucial to know the type of headache and seek appropriate treatment. We have discussed different types of headaches in this video. What's the cure? 1. Creatine monohydrate for TBI. Creatine monohydrate is a supplement that can be used in higher dosages than those used for muscle performance to alleviate headaches from traumatic brain injury, TBI. The mechanism is that nerve cells rely on calcium to generate an action potential, and creatine can be stored in brain tissue to improve cognition. Research has shown that creatine monohydrate dramatically decreases the frequency of headaches after TBI and shows promise for reducing headaches, dizziness, and fatigue from other origins. 2. Diets high in omega-3. A diet high in omega-3, 1 gram EPA per day from supplements or through foods and low in omega-6 can be beneficial in reducing pain from headaches. Even if you only increase omega-3 without changing omega-6, you will experience a reduction in the severity of pain from a headache. People who ingest more linoleic acid from omega-6 experience more inflammation, vasodilation, and headaches. A reduction in pain is particularly noticeable in hormone-related headaches during menstruation. 3. Offsetting photophobia from migraine headaches. One way to offset photophobia from migraine headaches is to avoid activating cells that would trigger photophobia in the first place. If you feel a migraine coming on, you can shift to using dim orange or red light and avoid blue light. If you can offset early signs, you can reduce the probability of headaches entirely. 4. Tension headaches treatment. The most common treatment for tension headaches is NSAIDs, but tolerance develops quickly and may offset the benefits. Botox is an advanced modern treatment for tension headaches when injected into the muscles. Do any of the non-traditional treatments for headache work? Some oils outperform over-the-counter NSAIDs for the treatment of headaches without the side effects. Some essential oils effectively treat headaches without the side effects associated with traditional NSAIDs. Peppermint oil, when applied to the temple and forehead, has been found to reduce pain from headaches, increase cognitive performance during headaches, and relax muscles. Peppermint selectively activates certain sensory neurons and inhibits others, which is believed to be the mechanism behind its effectiveness in treating headaches. Acupuncture has been used successfully to treat headaches and pain. Acupuncture has been used for centuries to treat pain, including headaches. The practice involves inserting thin needles into specific points on the body to stimulate sensory nerves and reduce inflammation. Acupuncture has been found to be effective in treating headaches by reducing inflammation by activating certain sensory neurons and deactivating certain motor neuron pathways. Caffeine is both a vasodilator and vasoconstrictor. Caffeine has both vasodilator and vasoconstrictor effects on the body. As a vasoconstrictor, it blocks adenosine, a vasodilator, which can alleviate headaches caused by vasodilation. On the other hand, caffeine can also influence the nitric oxide pathway that causes the dilation of blood vessels, making it a vasodilator. The effects of caffeine depend on factors such as the time of day and the individual's level of rest. Try non-traditional treatments instead of or in conjunction with other treatments. Non-traditional treatments such as essential oils, acupuncture, and curcumin can be used as alternative or complementary treatments to traditional medication for headaches. Discussing these options with a healthcare provider before use is essential to ensure safety and avoid any potential interactions with other medications. Curcumin is known to have potent anti-inflammatory effects alone and in conjunction with omega-3 and reduces the frequency and intensity of headaches. Curcumin, the active ingredient in turmeric, has been found to have potent anti-inflammatory effects and can reduce the frequency and intensity of headaches, especially when used with omega-3. It's important to be mindful of the dosage as curcumin is an inhibitor of dihydrotestosterone. A dose of 25 to 80 milligrams daily is recommended to avoid potential side effects. Some spicy foods can induce headaches. Spicy foods can induce headaches in some individuals. It's important to be aware of your tolerance and avoid excessively spicy foods. The Carolina Reaper, in particular, can cause hyperconstriction in the vasculature of the brain and brain damage, which may be permanent. Headaches can be challenging and frustrating to manage, but with the right knowledge and strategies, it is possible to find relief. By understanding the various causes and types of headaches, we can tailor our treatments and incorporate science-based strategies into our daily routine to alleviate symptoms. We hope this video has provided valuable insights and practical tips to help you on your journey to a pain-free future. Thanks for watching, and be sure to like and subscribe for more life-changing content.